Good morning. Today's topic is development and anatomy of female genital system. Development of genital organ and gland. The site of origin is from urogenital sinus. The endodermal cloaca is divided by coronary oriented vertical partition known as urorectal septum. The urorectal septum contains a pair of paramesonephric duct close to midline and a pair of mesonephric duct laterally. The dorsal part of endodermal cloaca, thus formed, differentiate to form the rectum and anal canal. The ventral portion, known as urogenital sinus, differentiated to three parts: upper vesicourethral part, middle pelvic part of urogenital sinus, and the lower phallic part of urogenital sinus. This is a diagrammatic representation showing differentiation of female external genitalia. Development of genital organ and gonads. Clitoris is developed from the genital tubercle. Labia minora are developed from genital fold. Labia majora are developed from genital swelling. The Bartholin glands are developed as outgrowth from the caudal part of the urogenital sinus and correspond to bulbourethral gland of male. The vestibule, the inferior portion of the pelvic part, and the whole of the phallic part of the urogenital sinus expand to form the vestibule of the vagina at about fifth month. Development of internal genital organ that includes fallopian tube, broad ligament, vagina, uterus. The major part of female genital tract develops from the Mullerian duct. The duct forms one on each side as an ingrowth of coelomic epithelium in the lateral aspect of mesonephros at about 56 week. While it grows downward, it has developed three parts: cranial vertical, medial horizontal, caudal vertical after crossing the Wolffian duct anteriorly. In the absence of androgen, testosterone, and anti-Mullerian hormone, as in normal female, there is further growth and development of the Mullerian duct system with the regression of Wolffian duct. This is a diagrammatic representation showing development of female reproductive system from the primitive genital duct. Vestigial structure also shown: female fetus at 12 week and newborn female. Fallopian tube. Fallopian tube is developed from upper vertical part and the adjoining horizontal part of Mullerian duct. Coelomic opening of the duct becomes the abdominal ostia. Uterus. Uterus is developed by the fusion of intermediate horizontal and the adjoining vertical part of Mullerian ducts, which begin at 7 to 8 week, and it is about 22 millimeter of crown rump length. Cervix is developed from the fused lower vertical part of the two paramesonephric ducts. The intervening septum disappears during fifth month of the intrauterine life. Myometrium and endometrious stroma are developed from the mesoderm of the paramesonephric duct. Broad ligament. When the Mullerian duct approaches each other in the midline, broad transverse fold is established, extend from the lateral side of fused Mullerian duct up to the lateral pelvic wall, which is named as broad ligament. All the vestigial remnant of mesonephric tubule, that is epinephron, situated above the ovary, paroperon, between ovary and uterus, and the duct. Remnant as partner duct are also found in the broad ligament in the mesocervix. Vagina. Development of vagina is composite partly from the Mullerian paramesonephric duct and partly from the urogenital sinus. Paramesonephric duct develop at about 6 weeks as a invagination of coelomic epithelium lateral to each mesonephric Wolffian duct. Each paramesonephric duct passes ventral to corresponding mesonephric duct and then meets the counterpart from the opposite side in the midline. The lower vertical part of two paramesonephric, that is Mullerian duct, pass caudally void in the urorectal septum meet each other. Around 9 week, the solid caudal tip of the fused vertical part of the Mullerian duct project blindly into the dorsal wall of urogenital sinus as Mullerian tubercle. This is again a diagrammatic representation of development of genitourinary system. Vagina. Vagina, the united lower vertical part from the uterovaginal canal and the fused Mullerian tubercle from the Mullerian eminence. The unfused cranial part of each paramesonephric form the uterine tube and the distal open end form the abdominal ostia. Endodermal cells form the dorsal wall of urogenital sinus, proliferate and form the sinovaginal wall. Endodermal cells further proliferate and extend cranially into the central axis to form a solid plate called vaginal plate. Central cells of the Mullerian eminence disintegrate so that the vaginal canal now opens into the urogenital sinus and the tissue at the periphery persists as hymen. Vagina, upper 3/5 above the hymen, develops from the fused uterovaginal canal of the Mullerian duct. Mucous membrane is developed from the endoderm of the canal, and the musculature is developed from the mesoderm. The hymen is developed from junction of Mullerian tubercle and the urogenital sinus. Lower one-fifth below the hymen is developed entirely from the endoderm of urogenital sinus. Vaginal introitus is developed from the ectoderm of the genital folds after the rupture of bilaminar urogenital membrane. Female reproductive system anatomy. Female reproductive system. The reproductive tract is contained mainly in the pelvic cavity and the perineum. It is divided external genitalia and internal genitalia. Female external genitalia. That's it. Vulva is the term given to the female external genitalia. It includes mons pubis, labia majora, labia minora, clitoris, urethral opening, vaginal opening, and the perineum. This is the diagram showing the same. Mons pubis. It is a triangular mound of fatty tissue that covers the pubic bone. It protects the pubic symphysis. During the adolescence, sex hormone triggers the growth of pubic hair on the mons pubis. Hair varies in the coarseness, curliness, amount, color, and thickness. Labia majora, outer lip-like structure. They have a darker pigmentation. The labia majora protects the introitus, urethral opening, are covered with the hair, and the sebaceous glands become flaccid with the age and after childbirth. Labia minora, also referred as the inner lips, made up of erectile connective tissue that darkens and swells during sexual arousal. Located inside the labia majora, they are more sensitive and responsive to touch than the labia majora. The labia minora tightens during the intercourse. Clitoris, a small penis-like structure, highly sensitive organ composed of nerve, blood vessels, erectile tissue located under the prepuce. It is made up of shaft and a glass, becomes engorged with blood during sexual arousal. Keys to sexual pleasure for the most women, urethral opening is located directly below the clitoris. Vaginal opening introitus. A mucous membrane normally covers the opening in the vagina is called hymen. Using the presence of intact hymen for determine virginity is erroneous. Some women are born without hymen. Posterior to vaginal opening are two Bartholin glands. Perineum. The muscles and the tissue located between the vaginal opening and the inner canal considered to be a perineum. It supports the surrounds the lower part of the urinary and the digestive tract. The perineum contains an abundance of nerve ending and that make it sensitive to touch. A diagram showing the external genitalia and the perineum. Female internal genitalia. The internal genitalia consist of vagina, cervix, uterus, fallopian tube, and the ovaries. Diagram is a sagittal view showing the same. This is a coronal view of the same. It's showing the fundus of the uterus, triangular cavity, fallopian tube, ovarian, broad ligament, vagina, cervix, internos, externos, cornices, blood supply. Vagina. So in vagina, it is a distensible fibromuscular tube that extends from the perineum through the pelvic floor and into the pelvic cavity. It measures approximately 8 to 12 centimeter in the length. It extends from the vestibule to the uterus and situated behind the bladder and in front of rectum. It is directed upwards and backward. Its axis formed with that of the uterus at an angle over the 90 opening forward. मेरा गला दुखेगा लेकिन it is distensible fibromuscular tube that extends from the perineum through the pelvic floor and into the pelvic cavity. It measures approximately 8 to 12 centimeters. Anterior wall of the vagina is related to base of bladder and to the urethra. In fact, the urethra is embedded in or fused to the anterior vaginal wall. Posteriorly, the vagina is related principally to rectum. Vagina. The first vaginal fornix is the recess found between the margin of cervix and the vaginal wall. Based on the position, the fornix is subdivided into a posterior fornix and anterior fornix and the two lateral fornix. Vagina. Blood supply to the vagina from the vaginal artery of the internal iliac artery and vaginal branch of the uterine artery. Lymphatic drainage. Lymph from the upper vagina drain into the internal and external iliac nodes. Lymph from the lower vagina drain into superficially inguinal nodes. Uterus. The uterus is a thick walled muscular organ in the midline between the bladder and the rectum. It consists of body and cervix. Inferiorly, it joins the vagina. Superiorly, uterine tube projects laterally from the uterus and open into peritoneal cavity immediately adjacent to ovary. Uterus. The body of uterus is flattened anterior-posteriorly and above the level of origin of uterine tube. It has a rounded superior end that is called fundus of uterus. The cavity of body of uterus is narrow slit. When viewed laterally, it is shaped like an inverted triangle when viewed anteriorly. Each of the superior corner of cavity is continuous with the lumen of uterine tube. The inferior corner is continuous with the central canal of cervix. The body of uterus normally arches forward over the superior surface of the emptied bladder. Uterus. Cervix forms the inferior portion or part of the uterus and is shaped like a short, broad cylinder with a narrow central channel. The cervix is angled forward and diverted on the vagina so that the inferior end of the cervix projected into the upper anterior aspect of the vagina. Relation of the uterus. Anteriorly, uterus and cervix are related to the retrovesical pouch and superior surface of the bladder. Posteriorly, uterus is related to the rectouterine pouch of the pouch of Douglas, which extend down as far as the posterior fornix of the vagina. Literally, the broad ligament. Uterus. The blood supply uterus is from the uterine artery, that is again a branch of internal iliac artery. Lymphatic drainage. Lymphatic from the fundus accompany the ovarian artery and drain into the para-aortic nodes. Lymphatic from the body and cervix drain to the internal external iliac nodes. This is a diagrammatic schematic diagram showing the blood supply of internal genital system. Ovary. Ovary are the gonads and it is a site for the oogenesis for the production of egg like the testis in the men. Ovary lie adjacent to lateral pelvic wall just inferior to pelvic inlet. Each of the two almond-shaped ovary is about 3 cm long and suspended by mesentery, the mesoovarium from the posterior aspect of broad ligament. The ovary. The blood supply of ovary is from the abdominal aorta through the ovarian artery branch, lymphatic drain to para-aortic lymph node, venous drainage to the inferior vena cava on the right and to the left, renal vein on the left. This is the blood supply and venous drainage for the uterus, vagina, and ovary. Thank you.